Hi, my name is Nicole White, and I'll be doing my speech on post-traumatic stress syndrome and how it affects the body. Raise your hand if you could list the first requirement of being diagnosed with post-traumatic stress syndrome. Well, if you're thinking of someone who has experienced a trauma, a traumatic event that involves some type of physical threat, then you are correct. According to Kramer and Eagle 2010, in their book states that the word trauma has been referred to as a worldwide variety of experiences, including emotional, stressful ones. Whether you experience a trauma or not, the outcomes can still affect you. However, according to the U.S. Department of Veterans Affairs, it shows about 15% to 43% of girls go through at least one trauma. In addition, as for boys, 14% to about 43% have gone through at least one trauma. Of those children and teens who experience it, 3 to 15% develop PTSD, also known as post traumatic stress syndrome. I am credible for this research because I have done extensive research in post traumatic stress syndrome, and I even have some experiences of people who do have post traumatic stress syndrome. Not only could it affect your person, it can also affect the ones that you love the most. Throughout this research, I have become knowledgeable to explain the different types of PTSD and how they can affect the body. In this speech, I will inform you on the PTSDs out in the world and the cause and effect that it has on people and others. First, I will focus on what PTSD consists of. Second, I will develop the cause and effect it has on someone's health. Last, I will discuss how PTSD can affect your future life. Now that I have given you an overview of the discussion today, let's move into our first main point. What is PTSD? According to Sackett 2015, PTSD is a condition defined by the Diagnostics and Statistical Manual of Mental Disorders, also known as DSM. As according when an individual has experienced, witnessed, or been confronted with an event or events that involves actual or threatened death or serious injury or a threat to a physical integrity of another person. Now, let's talk about when PTSD was introduced. PTSD was first introduced as a psychiatric disorder in 1980, but since it's been refined through systematic clinical research, according to Kramer and Eagle in 2010. Trauma is a psychoanalytic tradition. It is often used to refer emotionally damaged life experiences, such as having extremely damaging life experiences, such as extremely critical or emotional unresponsive. Now that you know a little bit more about what this disorder is and the causes, let's move to our second point. The causes of PTSD. The types of events that can lead to PTSD are serious accidents, physical or sexual assault, abuse, including childhood or domestic abuse, exposure to traumatic events at work, including remote exposure. This is according to NHS UK 2018. Abuse and neglect is one of the causes of PTSD. Sexual and physical abuse has a statistic of 10% of sexual and 18% are physical. With 16% of being neglected, it totals out that only 10% are sexual, 18% are physical, and 65% are neglection. Now that you have an idea of how many events can cause PTSD, let's go into how it can affect your health. It can affect your health by raised blood pressure, increased heart rate, increased sweating. It can reduce stomach activity, such as loss of appetite, and this is according to Mental Health Foundation. The cause and effect of PTSD, it can have short-time memory loss, or you can have a long-time chronic psychological repercussions, according to the American Psychological Association. This all includes 5.5 million children. Of the reported cases, there is proof of abuse in about 30%. U.S. Department of Veterans Affairs. Medication is optional for treatment. Doctors may prescribe medications other than Zoloft or Paxil